Item 3-2000043, communication from the Milwaukee Health Department providing an update on its efforts responding to the COVID-19 pandemic. And I would ask everybody watching and viewing, this file has been uploaded, correct, Joanna, into the Legistar, I believe, the presentation? Yes, okay, just wanted to double check for people watching. It's also in Legistar. And with that, we have our Commissioner of Health, Kirsten Johnson.
Good morning.
Morning.
Okay, I think I've got it. Hi. Good morning.
Good morning.
So COVID update in the city of Milwaukee, we're still in the extreme transmission. Our current burden is 323.1 per 100,000 over the past 7 days. It's been fluctuating up and down over the past 2 weeks. It's still continually in the extreme transmission. The percent positivity of tests is in substantial transmission. We've been in this 9 to 10% range for a number of weeks. And the city of Milwaukee adult vaccination rate, so people who are fully vaccinated, is 56%. I've shown this slide previously. Again, this is the wastewater treatment data. You can see what it looks like we're heading. We've been at this long plateau. It's starting to drop down a little bit. Again, we just really look at this to make sure that it's aligning with our actual burden data that we're collecting on our end from cases. Variants in Wisconsin, it is still predominantly Delta, 95% in the last week. This data is collected at the State Lab of Hygiene, is tremendously helpful. We saw, again, midsummer, the sudden spike in Delta predominance, and then again, that it correlated with our increase in number of cases. Vaccine data, so as I mentioned previously, 56% of adults in the city of Milwaukee are fully vaccinated. 61.6% of adults have received a single dose, so that's has increased. 39.3% of 12 to 15-year-olds have had at least one dose. We've done 411 mobile clinics and administered 11,714 doses through those mobile clinics. That's been a tremendously successful effort. And we've administered 542 doses in our door-to-door campaign. I wanted to talk briefly about the incentive. So we had implemented a $100 incentive starting last Thursday, September 23rd. We had a significant increase in the number of people who presented at our South Side and Northwest Health Centers.
Thank you. Hang up or press the pound.
You can see here the increase in the number of doses week to week. So if you look at the week before, we had 139, and then the week of the incentive was over 180. And actually, I'm going to skip this slide and come back to it. But here's a sort of a visual of the vaccination at selected sites. So you can see under the week before, I think the correlating day was September 17th. We did, or maybe it was the 16th, 88 and 71. And then the following week, once we implemented the incentive, was at 229 and 167. So you can really see visually that the vaccine incentive was quite effective in the first week. And we were out by Saturday or Monday morning. I'm going to go back to the booster slide if I can. Oh, it's not letting me. There we go. So it's been quite in the news quite a bit in the last few weeks, but the vaccine boosters were approved. DHS gave us their guidance on Monday, so the following population should receive a dose 6 months after receiving their first dose, or after receiving their second dose. So people are 65 years and older, residents living in long-term care, and individuals between 50 and 64 years who have underlying medical conditions. And then there was also language about populations who may receive a booster, so anyone between the ages of 18 and 49 with certain underlying medical conditions, and individuals between the ages of 18 and 64 who are at increased risk due to job or where, their exposure levels. So this would include teachers, healthcare providers, public health personnel, et cetera. This is just a slide, again, of you can see the number of vaccinations over time, and that, again, I think I pointed this out the last meeting, heading into school, we saw a pretty significant increase in children between the ages of 12 and 15 who are being vaccinated, which is great, but we're still at a relatively low rate of vaccination there. So the Children's Hospital of Wisconsin continues to see a high number of children hospitalized because of respiratory viruses, which does include COVID. The average number of daily hospitalizations testing positive is increasing. That includes children who are there for other reasons. So they may be asymptomatic, but when they are admitted to the hospital, they are tested. So they may not be there for COVID. They may be there for surgery or something else. We have continued to see a rising number of COVID cases in children across the state. And the pediatric hospitalization rate for COVID-19 is the highest we've seen. The previous high was in November 2020. Again, I think this is a direct correlation of the level of the burden of the virus in our community. Again, I've shown this in the past, but you can see the RSV infection rate is traditionally we see that virus in the winter, January, February. You can see how high it is right now. So RSV and rhinoentero viral infections are really where we're seeing a large number of infections in children. And this is a slide, daily cases in Milwaukee County. The blue is the Milwaukee County suburbs, the orange is the city of Milwaukee, so in children under the age of 18. Again, you can see that increase is correlated back, and that previous peak is in November of 2020. And then cumulative confirmed cases by age. And I just want to point out that the 15 to 17-year-olds is the highest. Again, these are children who are eligible for vaccine, and we're hovering in that 35-36% of those children vaccinated, so the emphasis really needs to be on getting those vaccine in those kids' arms. The next highest is 12 to 14 in the teal. So again, all of these populations are eligible for vaccine. And questions?
Thank you so much. Questions by committee for the commissioner on our COVID report? Alderman Spiker.
Thank you, Madam Chair. Thank you, Commissioner, for the presentation. I owe you an apology for last time because I said that it wasn't in the file and it had been sent to our emails and I just missed it, so I apologize for that.
Thank you.
Regarding the $100 incentive, are we finding that it works better with certain age ranges than others? Is there any sort of area that we're getting the most bang for our buck? I haven't seen the finalized data, but no, it seemed to be across age ranges. And it seemed to really incentivize people on the first day. So we had a huge increase in the number of people who showed up on the first day it was available. We actually had lines at the Southside Health Center of people waiting to get vaccinated. And then it sort of trickled off. But we still saw increased numbers over the week prior. But what the interesting piece about the week prior is the $100 governor's vaccine incentive was available. Right.
So I think it really has something to do with we were literally handing people the card as they were getting vaccinated. So it was an immediate incentive.
I see.
And it was, again, I think more targeted to Milwaukee and to the populations we're trying to reach. So
Right. And we might have, did we get a significant media exposure
we
for
did.
that? Yep.
There was quite a bit of media around it. So I think that contributed. We are talking internally about how we can continue. I think rather than having an incentive available for a long period of time, I think the sort of one shot, like, we're getting X number and they're available starting this date is probably more effective.
Yeah, that would seem to be what the data is supporting here. You just,
Yeah.
you get the rush and boom, do it then, and then, enthusiasm wanes, and
Right.
then you hit it again. So does the $100 seem to be the right number? Have we dialed it in? Are we looking at what other communities have done around the country? Does that seem to be the most common figure that is pulled out and most
So I'm
effective?
sure everyone's aware of the communities that had like the $1 million
Lottery.
lotteries, the in-state tuition lotteries. There was significant data from the Kaiser Family Foundation, and there are now some published articles around what is effective. It seems that $100, and we did see a number of people present for the $100 gift card. The component, but in a lot of the data is really around that first dose. We are thinking internally about how do we incentivize the second dose, potentially not just for the people who just got their first dose, but also for people who had gotten their first dose and just have been reluctant or haven't had time to get their second. I think it will likely be a lesser amount, and again, will be available to more people than just this first round of incentivized for the $100, but we're talking internally about what that looks like.
Okay, and is there any concern or looking at what other communities have done about people then holding out till the cash appears for the second dose?
It
or-
doesn't seem like that's
Okay.
been at least the data's not showing that. Again, there's less information around the second dose versus the first.
Right. For MPS's incentive, so they, my son was quite disappointed to hear that the money was going out when he thought it wasn't going to apply to him because he's already fully vaccinated, but then he learned it's retroactive. When they gave the incentive for students and then the mandate for staff, have we seen appreciable differences in behavior there?
We haven't. So there is some data that you can see there's a blip after the MPS announced their vaccine incentive for students. You can see a little blip, but it's not significant.
Okay.
Yeah.
Huh. Any explanation? I know it would be somewhat speculative about why MPS didn't have the effect they had with their 100. I would think that age group would sure like $100 in their pocket.
Right. I don't know. I do know that if you look at data around children who are being vaccinated, it's a subset of the parents who are vaccinated. So I think we're going to be in this constant struggle of we need more parents to get vaccinated, and in turn, they will be more willing to have their children vaccinated. So I think
Right.
those two sort of are in lockstep.
And does it work in which direction? So the trick for years has been educate the kids, they'll educate their parents. Do we have any evidence of that direction of causality working, that the kids, you get them on board and suddenly their parents are doing it? Or
So
is
we
it the
don't
reverse?
have a tremendous amount of data. Part of it is too that children need
Parental permission.
The parental, right?
Right. Sticking with kids for a second, the Pfizer vaccine on the horizon, possibly for 5 to 11.
Yes.
Could you briefly describe the impact that could have? I know we had a discussion last time about trying to reach so-called community herd immunity and needing it to span the gamut, not just those who are eligible for a vaccine now, but all of humanity.
Right.
So what could be the potential impact of getting that group able to get vaccinated?
So I think it will get us closer to herd immunity and protect more children who are in classrooms today. I think, again, we're going to have a subset of parents who are vaccinating their children. So chances are the data and the numbers coming out are going to be similar to the 35-36% that we see in the 12 to 15. We're likely to see something similar in our 5 to 11.
Right. So your earlier point, which you had just made, that it still requires parental permission, and it's still probably the kids of folks who are getting vaccinated who are themselves the kids getting vaccinated. Right. That trend you expect to continue in the 5 to 11 range.
We would expect to see that.
Has MPS given the city a seat at the table for discussions about how to improve their ability to get their kids vaccinated?
So we've really been talking more about operationalizing. So on our end, how do we partner with them to provide vaccine on site? So one of the challenges we're faced with is mass vaccination sites aren't necessarily kid-friendly. So how do we provide vaccine in a space that children are comfortable being in? One of the ideas we have is specifically around in classrooms or in schools where they are familiar and it's a comfortable space. So we are looking at working closely with MPS to actually administer the vaccine.
Yeah, and the vaccine has been available for 12 and up for a while now. Is there any good reason that city health officers aren't going into MPS schools and vaccinating people?
So we have been having clinics at MPS schools sites, but again,
Right.
we need the parental permission.
Right.
So we've set them up so that parents can sign either ahead of time or come with their children to be vaccinated. So we have had those ongoing clinic sites.
Yeah, and I'm aware of the clinics, but do you feel like it's gotten the reach that you would have hoped for based on?
I think we actually just had a conversation this morning about being very strategic about where, for example, there are children's hospital nurses who are staffing schools and identifying those schools and engaging those specific staff in part of this effort to try to sort of be more thoughtful and about how we provide the vaccine to kids. But I mean,
Okay.
yeah.
Yeah, no, that's reasonable.
Yep.
And last question, and I'll save the discussion of masks for later. Employee vaccination at the city. This is more DER's bailiwick, but we have orders, basically, to either vaccinate, provide proof that you need an accommodation, or else unpaid leave. What do you think the impact could be there? Have you heard anything? And again, if this is DER's responsibility to answer, that's fine to beg off. But what does the health department think about how that process is likely to play out, and what impact would it have on our general battle to vaccinate?
So, I mean, all the research is showing that vaccine mandates are effective in getting more people vaccinated. We're seeing that across the country. We've seen it actually across the world. So I think it will have a positive impact on the number of people vaccinated in working for the city of Milwaukee. I can only speak anecdotally about what we've experienced in the health department in terms of staff members who are asking for an exemption, and it's really just a handful.
Okay.
A small number.
All right, thank you, Madam Chair.
Thank you. Alderman Borkowski, and then Alderman Jose Perez is asked to be recognized. Alderman Mark Borkowski.
Thank you, Madam Chair. So, Madam Commissioner, Alderman Spiker was on the verge of some of the questions I had, and it's probably not a fair question to ask you now, but we do have our next public safety meeting, which is October 21st. So a number of employees that the City of Milwaukee has, okay, and then I'm looking at if there are some still that are holding out and their positions are going to be eliminated, then what does that mean to the work for the City of Milwaukee? And so, and maybe that's a DER question, that could be part of your report.
Okay.
Sure.
Next time, but I think we should anticipate that if we're going to have vacancies, what does that mean? We'll be coming into the winter season with, snow plowing, and obviously recycling and sanitation pickups still need to happen, and what it might mean to other departments. So if I could be proactive and ask you to have those as close to being answered as possible, and you'll probably need your colleague from DER with you.
Okay, I think we can get that for the next meeting, or even before that, I guess we'll see. Might also be an item of interest at finance, but I can understand why we would want it here, yeah.
What is the deadline? Is it November 1st for City of Milwaukee
It was
employees?
October 29th, I think, whatever that Friday is.
Right. I believe so, too. In my mind, I have like the MPS one, the County of Milwaukee,
Right.
I think is coming up. A lot of them are coming up in October, but I can't
It's
particularly.
the last
recall.
week. It's the last Friday in October.
Yeah,
Well, so thank you.
okay.
I can say the national data is showing roughly about 1% of employees of any given organization are either being terminated or choosing not to get vaccinated.
I'm sorry, I didn't hear that. I didn't.
Roughly 1% of any given organization that employees are choosing not to be vaccinated or are being terminated.
1%?
1% or less. I mean, it's a much lower number than I think people anticipated initially.
Okay, thank you.
Yeah.
Thank you. Alderman Jose Perez.
Thank you, Madam Chair. My question for the commissioner is, could you expand a little bit on the health department's role, the response, the coordination? When I think about 3 weeks ago, NPS numbers for students that contracted COVID was at about 400. Today we're at 1,000.
Sure.
And what's our role in assisting in this? Because you mentioned the incentive and the vaccination portion of what's going on at MPS, or the initiative going on, but as far as I know, it hasn't been implemented. I mean, there's talk about vaccination at schools, and I have children at 2 different MPS schools, and we've heard nothing about the who, what, where, and when about vaccination happening at those schools for those that aren't vaccinated.
Okay. I can speak to the role we've played in contact tracing and identifying of positive cases. So when we get, and this is, nothing's changed since last spring, when we have an identified case that we get the positive lab report, we do a full investigation. We contact the positive case, talk to their parents if they're under the age of 18, speak to them, and then also identify their close contacts, and then we do the contact tracing. We have prioritized children. So anyone under the age of 18 and school-age children have been prioritized within the health department. We are not behind. We have, as of yesterday, are fully caught up. Had called every single person, every single child who's positive in the city. We are working with MPS and have reached out and asked to do some more targeted training around contact tracing to assure that we're all have the same understanding. So MPS on their end, when there's a positive child in a school, their role is to identify those close contacts and do the parent notification through the school. They have form letters. I know I'm also an MPS parent, received a form letter that there was a positive case in my children's school. And then on our end, they send us the list of contacts, and then we will do an additional follow-up with those close contacts that are identified in the school setting.
And then, okay, so I understand the procedure that you do with positive cases. I think the question was asked by Alderman Spiker, how are you at the table, or how was your input? Because look, if there's mass mandates, and in 3 weeks, the numbers went from 400 to 1,000, at what point are we gonna get involved in a different way because something isn't working? I'm concerned, with clubs going on and the amount of time that they already spend in school, then with extracurricular activities. I'm worried. And then the other question I had is around these vaccination. Is there a time frame, a timetable when they're going to be implemented? Can people look forward to that?
So the vaccination clinics will be we're planning them now, but again, we did them all summer at all MPS schools, or at a handful of MPS schools. We are also going to do vaccination clinics for children once the childhood vaccines are available. So those are being planned. So once it's available, then those clinics will be implemented. We do know that the majority of cases are contracted outside of the school setting, so universal masking in the school district is effective. We learned that last year across the country, that when children are masked in classrooms, it works and slows the spread within the classroom setting. The challenge, though, is the birthday parties, the sleepovers, the family gatherings, the informal events, the extracurricular activities. That is truly where we're seeing spread, and we're also seeing spread from family members to family members. So parents who are going to work or socializing are contracting it from their groups, their family members, their close friends, and then transmitting it to their children. So again, the school setting itself is very well controlled and safe. The challenge is these other activities, family events, gatherings, informal events that are driving the cases in children and in our community.
Okay, so do we have data then that through contact tracing that it's not getting spread at schools then?
We do, and you can also see it's very rare that you have, it does occur, I'm not going to say it doesn't occur at all, but it's rare that you have multiple cases in the same classroom if everyone is masked.
Thank you. And then are vaccine clinics going to happen at the middle school or high school level then?
So we will likely.
Is there some?
Yep, we will likely focus on elementary and middle school because we did focus on high school in the summer and in the spring when high school students were eligible. So we'll be focusing on the next sort of population, but also offering it for older students.
Thank you.
Okay, thank you very much. I want to continue on the item of schools. I guess I see things a little bit differently. Are you aware that we now have 4 schools that are closed? I just got the information today because the dashboard, so I wanted everyone in the public. We had 1 at our last meeting. We're now, that's 4 times more. So I believe it's Golda Meir, Lancaster, Hartford, and then Morse. So 4 schools have reached in Milwaukee Public Schools more than 3% positivity. That is a big change from our last meeting where we talked about this. I guess what I'm concerned about is, do we actually have the data that shows that there's, like what Alderman Perez was saying, that there isn't an outbreak in the school? I mean, when it reaches that high of 3%, what's going on in those schools that are causing that situation?
So if you look, there are 1,000 positive students, but if you look at the ratio of staff to students, it's much higher than staff. It's much more likely that schools are closing because they have a higher ratio of staff who are positive and they can't staff their classrooms anymore. We saw this occur all across the country all year last year. There's low rates of transmission when there's universal masking in the classroom between children. The 3% number that MPS has identified is their threshold that they're comfortable with a closing classroom. That's actually a fairly low number of infections. I can't speak to the actual populations of those schools because I don't know them, but I'm sure someone could quickly do the math and figure out what the number of people who are actually infected, and it's over the course of 14 days. I think they're taking a very safe approach by closing the schools with a 3%. It's, again, highly unlikely transmission's happening in those classrooms, but they're making sure that it stops, and the 14-day, or the closure assures that the transmission stops. But again, if you look at the ratio of staff and students to the overall infection rate at MPS, it's a much higher ratio of staff.
Well, I'd like to push back a bit on that data point because that seems a bit of a challenging characterization. We know there's challenges in testing children. They're not being tested at the same rate as adults. I mean, these adults, and we know that many are vaccinated. That data at the MPS dashboard, I believe, if I'm not mistaken, started prior to even school. So it's an aggregate of back to July. So, I mean, I'm just not sure it's the best snapshot. I agree that I don't really think things are going well when it comes to schools. 4 schools being closed, I just need everybody to think about this for a moment and not normalize it. 4 schools, that's thousands of kids and hundreds of families. And if it's I believe it's a 10-day shutdown, if I'm not mistaken. If you don't have childcare backed up, and likely you're not going to get childcare because who wants a quarantined child at this time due to protocols, that is devastating to our local economy. And it feels like nobody wants to talk about it, but for those people that are experiencing it, it's a tiny lockdown. It's what it feels like. So we're back where we started. The numbers in your presentation show that we're back to pre-vaccination times in the amount of child cases. And so I'm really concerned about that. And I don't know what else we can do. Alderman Spiker brought this up, and I want to just clear the air on it as much as possible. We're in the receipt of a letter from a really large, diverse cross-section of people, LIT, Bloc, Voces La Frontera, the nurses, service employees, Citizen Action. We got this letter yesterday. I mean, that's a lot of diverse people in the community that are calling for an indoor mask order. Chicago has it, Racine. I've been vocal about it. And when we're talking about the things going on in the community, when we say that we've been, to my knowledge, I want to say it's 9 weeks in extreme transmission, purple extreme transmission. Some of the highest rates we've ever seen in the 300s per 100,000. Are we doing everything we can? And I don't think we are. And I want to just talk about that and address it, because if we say the schools are a microcosm or an example of what the community spread is in the community, to keep children safely in schools and keep our economy intact means we have to control the spread in the community. And so I don't know that we're doing everything we can, and I really want to specifically talk about the indoor mask order and get on the record your views on that.
Sure. So I feel very strongly that whatever policy or order that is put in place coming out of the health department needs to achieve the outcome we want to achieve. We know masking, universal masking in schools is very effective. It's a controlled environment. We can keep masks on students, we can keep masks on staff. We know that we can control spread in a school, in a classroom setting. an indoor mask mandate within the city of Milwaukee, there's no guarantee we're going to achieve the outcome we want to achieve, because we also know that people are predominantly getting it at events where they are with their family members, with people they're comfortable with other extracurriculars where there's no enforcement mechanism. Those are private gatherings, and the mandate that we put in place would not have an impact on those settings. And so the enforcement piece is another component that I think is incredibly challenging. If we put a mask mandate in place in the city of Milwaukee, you could go to Sendik's on Downer and have to wear a mask, but you could go to Sendik's in Whitefish Bay and wouldn't. And I don't think that it will have the impact we want, because people are going to go where they don't have to wear a mask if they don't want to wear a mask. And we have a mask advisory in place. We have strongly encouraging and supporting organizations and businesses that are requiring masking. Certainly strongly endorse and are very pleased with MPS's choice to have universal masking or mandate within their policy within the school system. Also, the majority of our private schools are requiring masks. So again, I want to be very thoughtful about policies we put in place to make sure they achieve the outcome we want to achieve. If I thought universal masking indoors was going to reduce the number of cases, I would do it. I don't feel strongly that it would. I don't think it will have the impact that we want it to have. And finally,
Commissioner, okay, go ahead.
Yep.
On that point, I don't understand that point, because you thought that previously. It's the CDC recommendation.
Yeah,
Science.
we are still recommending it, but the
Yeah.
enforcement piece is incredibly difficult. And if it's only the city of Milwaukee, people in the city of Milwaukee don't, the borders are fluid. It's only going to have an impact on and the other issue is that people are getting it in places where a mask mandate would not touch. So
And let
that's
me
where it's
ask this
spreading.
in a different way, though. What would be the negative impact if you
So,
leave this meeting and write the health order right now, which would immediately enact this body unanimously, everybody at this table when times were rough, unanimously, and we're at the same, I would say our indicators in the community are at the same or worse. I mean, schools are closing down.
So to
You
that
could go back to your office and write the health order now, and today at 5 p.m., people would be required to have masks indoors. What is the negative outcome of you doing that?
So the other component of this is truly the political environment we live in the state of Wisconsin. And the public health has come under intense scrutiny politically. And the statute that gives us the authority, so I'm not arguing that I don't have the authority. I certainly have the authority to do this. The statute that gives us that authority has also become threatened. I don't want to risk putting a policy in place that may not have the intended outcome or the outcome that we want to achieve, and risk the statute that gives me the authority to, for example, quarantine somebody who has whooping cough or a TB patient who potentially is spreading tuberculosis. I don't want to lose that authority for a policy that may not have the intended outcome that we want to have. I am not against a mask mandate. But I do think that if it's going to be done, it should be done legislatively. You've done it before. If the council feels that it will have the outcome that you want to achieve, then it should be done legislatively, and the council can you have that power to do it as well. The other piece I just want to mention is in November 2020, when our rates of children infection were as high as they are right now, kids were not in school, and there was a mask mandate in place, and those numbers were still high. So I just want to put that in context that, yes, it was pre-vaccine, but all of the components, there was an order for masking, there was an order on limitation of capacity limits, and our numbers, in fact, were higher at that point than they are now in the community. I just think we need to be reminded that the vaccines are working, and they are preventing critical illness and death in the population that's vaccinated. So again, the emphasis absolutely must be on vaccinating our children and vaccinating the adults around them, and that is how we are going to drive down our numbers.
Well, I appreciate that, and I thank you for clearing the air, but unfortunately, I respectfully disagree. I've made that comment a number of times. I objected to when the mask order and health order was rescinded. I said it was too early. We had a committee meeting here in July, and now look where we're at. And they're also not the exact same piece of data. We're dealing with the Delta variant, which wasn't last July, which we know is much more transmissible. And how can we look at those families in those 4 schools that are closed down right now, which is scary and it's going to be 10 days of complete chaos. And that was one school, now we're at 4. If we're here in 3 weeks at our next committee meeting and it's at 8 schools, what are we doing to disrupt this cycle? Why are we not trying everything that we have available to us? Who's going to look back and say, you know, we did too much? I think we're going to look back and say we didn't do enough. And I see your points, but we have a city attorney's opinion that says, and I'm in receipt of it and I've shared it out, that all it takes is a health order to reenact our masking ordinance that we adopted last year. So I don't understand why we can't move on this. It would take time to go through this entire legislative cycle again. It would take a month and a half when, if the commissioner chose, and she made it clear she's not going to, she could have it by 5 p.m. today. She could draw the health order. And by the way, that's what the city of Madison and Dane County Health Departments have done. Racine has something similar in the city of Chicago. So I do think that we stand out, and I just want to look back and say that we've done everything that we can to protect. I mean, it's the children. The pediatric beds are diminishing. I look at the state of Wisconsin in the Journal Sentinel today. We're the second worst in the nation for COVID spread.
I just want to comment that the city of Racine did it legislatively. It was not a health order.
And so did we. We did it legislatively. Why do I have to do my job twice? I can, I'm trying to get by once. So I strongly disagree. I've made it clear. I think we're in this situation and we have a tool. We only have really a couple tools, vaccines and masks, to mitigate the disease spread. And it's just, I want to state for the record, and then I want other people to speak. We have a very diverse coalition of people in our community that have written us and have asked for this. And it's hard to look them in the face and say, for some reason we can't, when we know that we can. We have the ability to do it today. And I just think that it feels as if we're normalizing the spread. It feels as if we're normalizing the high rates of children, and that we're normalizing schools closing, and I'm not going to do that. It's devastating to our economy, and it's devastating to the people that are going through it. And I already made this comment before. The first 2 schools that were closed are predominantly in our Black and brown communities. And that's something that, you're right, it's representative of the spread in the community. But that, excuse me, somebody needs to mute their mic. But it's representative, and it's like we've been doing this for a year and a half in this pandemic. So I've made my plea, I've asked for it. I want to let everybody know here that I am looking at what the next steps will be. I don't want to have to go to this body again and make the case. The case is made for itself. 9 weeks of extreme transmission? Who thinks that's okay? So I have said a lot. I think my position is very clear. I think it's unfortunate to have to ask this body once again to do it when it could be done. We wrote the order. The reason we wrote the order that way is if we just do it individually again, which Madison and Dane County did not do, then we're the body that has to always turn it on and off. The idea was to have it be through a health order so that when times are rough and we've been in extreme transmission, that we didn't have to go back every time legislatively. I'm the one that drew it, and you all supported it. That was the thinking. But never did I think we would be now in such a long time of extreme transmission and not use the tool that we have. So, and 4 schools closed. People keep saying they want everything back to normal, but these are not normal times. If we want to get back to normal, we're going to have to make some changes and a few tiny sacrifices so that children can stay in schools and families can continue working. Let's face it, it's an economic issue. It's a gender issue. It's a racial issue. So it's time to do everything we can. Who wants to be here next month at this committee meeting and hear that there's 10 schools closed? And then we say, oh man, we really should have done more. I don't want to be on that side. Anyone else at this time have additional questions or comments?
Madam Chair?
Yes, Alderman Spiker.
Thank you, Madam Chair. So, Commissioner, you mentioned with the 4 schools closing, that was as a result of reaching 3% positivity. So you have no authority to close those schools, correct?
No, that is done by MPS, and it's their own guidance.
And so the 3% positivity is a fact, but the closure of the schools is the decision made on the basis of that fact.
Correct.
Would you, and I'm putting you in the hot seat here, were you in that position, would you think 3% would automatically mandate the closure of the schools?
So I think it's a lot more gray. The challenge with 3% is if you reach a 3% threshold and none of those cases are related to one another because they are all contracted outside of the school setting, you may be closing school without a risk of spread. But again, I'm not privy to the full picture. If the 3% is because there is spread within a classroom that bleeds over to another classroom because they were in the lunchroom together, or it really is dependent on how the disease is spreading within that environment. And that piece, I don't know.
Understood. So the 3% that generates the closure decision, that 3% is not further analyzed to see whether the spread is taking place within the school or within the outside setting, which the closure of the school would send the students back into.
Right. I don't know that's an MPS decision.
Right, but just putting a fine point on it,
Yep.
if the spread is occurring in the community, the school closes, you're putting folks back in the community.
Right.
Right.
So you can go either of two ways, but it's not, what I wanted to be clear is you, Commissioner, are not making this decision to close. This decision to close is being made by MPS, and there might be more granularity needed in the decision-making in terms of looking at that 3% and where the spread is actually taking place. Second question is, there is, refresh my memory, I'm a parent here, but to go to an MPS school, and I don't want to be picking on MPS, it's schools in general, is there a requirement of proof of vaccination for any diseases besides SARS-CoV-2?
Yes. And the entire state is under the same law that applies to schools, public schools.
Right. So would there be anything in statute prohibiting the schools from mandating for those that can get vaccinated that they have to get vaccinated to show up for school?
Right. No, there's nothing prohibiting them from doing that.
So that would be a tool. I tell my kid every day, you don't have to work that much outside of school. School's your job. And just as employer, and this is not an entirely happy analogy, but just as employers can require their staff to get vaccinated or seek an accommodation, one might think that at least among the high schools, you could require that for coming in. I mean, we do it with all sorts of diseases.
Correct.
What's so special about SARS-CoV-2 that we would exempt it from the requirements we subject to a host of other diseases? And that the reason we subject it to the other diseases, it's amazingly effective as a way of preventing spread in schools. So if we're looking for a way to stop spread in schools, one line of thinking would be, instead of looking outside of schools and what we might do there in terms of masks, look inside of schools at what they might do to make sure the folks coming in have been vaccinated. And there is progress on that front with the staff requirement for vaccination at MPS. But as my son will tell you, the kids are way better at wearing masks than the adults. The adults, you see a lot of noses with adults. So tightening things up there on that end of things might be another way to go. With respect to the question of the harm of instituting a mask mandate, you raised a point I hadn't thought about, quite honestly. I don't know why I hadn't, but I just didn't, that you have a certain authority that's given to you by the state, and what the state giveth, the state can also take away. We've seen that. So your argument for not unilaterally declaring, activating the health order that would institute the mask mandate indoors is that, well, that's a powerful tool to use. If I'm going to use it, I want to make sure it's doing good. But my fear is that it won't stop the transmission. Right. Is that the argument you're making?
Yes. And
your argument for making that, or saying that, is because primarily the spread is in areas we can't reach, like at homes. That's a point well taken. Secondly, the enforcement piece you mentioned I don't think can be neglected either, or underestimated either, in that my district is surrounded by other municipalities. And I have business owners who have been frustrated. They want to do the right things in terms of requiring their customers to wear masks or what have you, but they also have to make a living. And when your customer can vote with their feet, and their feet can just go literally across the street, that's a problem for them. The enforcement mechanism we've had so far has been entirely on businesses. There was great hue and cry about having the police involved, writing tickets, which they frankly don't have time to be going in places writing tickets. We don't want them doing it. But if you don't do that, which, first of all, sidebar, they're still police officers, they still can enforce any law, so you can't prohibit them from enforcing the law. But setting that aside, putting it all on businesses and saying, look, you have to handle your customers coming in, that creates an antagonistic relationship immediately and cuts off a certain amount of your customer base, and it just puts an enormous stress on businesses that are already under a great deal of duress. So that would be what I would see as the thing I had thought about as a potential consequence. Now, maybe in the grand scheme of things even out, but it's surely a straw in the wind. It's surely something we ought to consider. Let's see if there's anything else. Yeah, that's plenty. All right, thank you, Commissioner. Thank you, Madam Chair.
Thank you. With all due respect, I could not disagree with the gentleman on my right, not on the right, on my right, on the right of me more on that. Where is the data that shows in Chicago and in Madison that their businesses have seen such an economic downturn by masking? In fact, I think the most challenging time for businesses is when they communicated to us when they had capacity. There's 0 capacity limits right now. We're out there celebrating the Milwaukee Brewers as if there wasn't, the worst increase in pediatric cases that we've seen and that people aren't missing school. The economic trials and tribulations are those for schools, families that aren't going to be able to go to restaurants or the grocery store or things like that. That's a mini shutdown. People can't go and enjoy the economy when they're ill and disease is spreading. So I would offer that, we have 0, we had how many moving Milwaukee forward orders that included capacity and changes the life that people dislike so greatly? And one, my other point I want to refute politely is the suggestion, if you're given the very order from the state of Wisconsin Constitution during a public health emergency and you don't use it, it's never been challenged. The Milwaukee ordinance that we had wasn't challenged once. Not once. And guess what? If things get challenged, you can take it to court and win or lose. I'm willing to go to court to save lives and keep children in schools. I'm not willing to be bullied by anybody, let alone the Republicans in the state of Wisconsin, of if we make a move, then they're going to come take something away. I can't wait to testify in court and tell people I think I did what was right during a pandemic. So I just don't feel that. I have to refute that frame because I don't agree with it in this discussion. I'm really glad we're having this discussion. My point is, what would it take to do a health order? You've made an argument, and I respect it. I respectfully disagree, but I'm asking you, what would it take? So you said why you wouldn't?
If I thought that a health order was
Yeah.
going to have the intended impact, as in decreasing disease, then I would issue a health order. I am not convinced that a mask mandate at this point in time will decrease transmission of the virus in our community. If I thought that was the silver bullet and it would do it, I would do it.
Okay, and but specifically, would it take 20 weeks of extreme transmission?
No, it depends on the policy. If I thought the policy was going to achieve the outcome we want to achieve, which is decreased disease transmission, I would do it.
And what
But
if
I
we
don't think this is it.
exponentially go from, we already went from the 70, we skipped red to purple, we're in purple for 10 weeks, now we close 10 more schools. What would it have to take? What is the picture of how bad things have to be? Is it 10, is it?
I don't think that we can describe what it would be.
No pediatric beds, none of those.
I think there's a lot of factors that come into play.
Wow, okay. Well, I would like to know, we're a data-based entity here, what factors it would take, what Chicago used, what Racine used, what Madison used, because I think at this committee it's frustrating, what are the indicators? How many weeks of purple, how many beds, our ICU beds, we used to have that dashboard that showed kind of the other, PPE, those kind of things. I think that the public needs to have a true image of how bad things are. This obsession with normal is just, it's not founded. And I want to get a grasp on what it would take to have that health order where we could disrupt this cycle and have more children in schools and be healthier. And that's something that I'm looking forward. Any other questions or comments from committee members on the COVID report? Oh, my last one is, so we got the slide about the boosters. When are we going to be able to give out the boosters?
We are doing boosters.
Oh, okay, so as of today, people
As of
can-
Monday, we were doing boosters.
Okay, people can sign up at our sites and
Yep.
get their boosters. Okay. And
And that goes for city staff too. So we have city clinics that are ongoing for staff who are getting either their first or second dose. City staff are welcome at those to receive their booster as well.
Yeah, thank you, Commissioner. And I want to use this public microphone to remind people, you'd be surprised actually how many people are eligible. You may fit a category in healthcare. The point is, please take a very good look at that. And I ask you to consider getting a booster as soon as possible. They're readily available, and there's a lot of healthcare, basically high-risk settings. If you choose an honor system that you're in a high-risk setting, it's your time to get a booster. So I really wanted to I think there was a initial confusion, myself included, but now, I mean, grocery
Yep.
store workers, so.
Essentially, if you're forward-facing with the public.
Forward, that's a good thing. Forward-facing with the public. That would include many of the work that we do. Yes, Alderman Borkowski.
Great segue. So where is the booster shot available for City of Milwaukee employees? Is it City Hall? Is it the Zeidler Building?
So there was a eGov notify that was sent out with all of the clinics that are upcoming. I think they're this week, to be honest. I don't know the dates offhand. But also you could go to the Northwest Health Center, Southside Health Center, anywhere. I mean, Walgreens, Meijer, Pick and Save, anywhere, they're all administering boosters. So anyone from the city is eligible for those.
And do you have to bring for the booster, do you have to bring your vaccination card?
Yes.
You do?
We would look it up for you, and everyone will look it up. But yes, you have to bring your vaccination. And there is one caveat. It is only for Pfizer. So Moderna, it will likely be available in the coming weeks. But as of right now, it's only if you received your first 2 doses of Pfizer can you get your booster of Pfizer.
Gotcha. Thank you.
Thank you. Any additional questions or comments on the item 3 COVID-19 pandemic report?
Madam Chair?
Yes, Alderman Spiker?
Just briefly, first of all, I think we here at city government can show no disrespect intended to the state and the federal government, but I think we can show how people can passionately disagree with each other and still have tremendous respect for each other and still do so in a civil way. I think we've demonstrated that here. I think we do it on a regular basis. That's critical for moving forward on any policy decision in an intelligent way. You want multiple perspectives. You want to weigh them, the merits and the demerits, and make a decision as a body. The point about the boosters was excellent and definitely worth making. I remember when the original dose came out, I was like, well, I'm not getting vaccinated until I make sure all my seniors are vaccinated in my district. I'm not stepping the line. Now the vaccine is so abundant, there should not be that sort of hesitancy. As the chair mentioned, there's far more people, and as the commissioner, as you mentioned, if you're forward-facing, basically take a look. You're probably eligible. And since there's so much vaccine, go ahead and get it.
Absolutely.
Okay. And then secondly, I guess you, Commissioner, had mentioned the legislative option we have. So if the council feels very strongly about it, we could, of course, call a special tomorrow, or the president could call a special tomorrow, and we could legislatively initiate the mask mandate.
Yes.
So if urgency is what it is, then we can do it. So, okay, just clearing that up. Thank you, Commissioner. Thank you, Madam Chair.
Okay, thank you. Any other questions or comments on this matter? Okay, the motion is by Alderman Rainey to hold to the call of the chair. Any discussion? Any objections? So ordered. Thank you, Commissioner.
Thank you.